Hi, everybody. Thanks for joining us. My name is Johanna Henderson, and I'm the Communications Manager here at BC Healthy Communities. I'm joining you today from Victoria, I should say, in the southwest corner of the province. And we can move on to the next slide, Yvonne. Thank you. Which is on the unceded territories of the Songhees, Esquimalt, and Wasanic nations, the Lekwungen-speaking peoples. And here at BCHC, we do that territorial acknowledgement, sort of a prompt for us to be reflective about the nature of our work and the colonial roots of the fields we work in, including planning and public health, and actually my own work, communications. And so I personally use those acknowledgements as kind of a prompt to think about how colonialism is embedded in the practice of my work and how I can continually challenge myself and shift my practice as I learn from, feedback that others give me, my own research, and the practices of others that I see. Next slide, Yvonne. Okay, so I see there are folks continuing to join, so I'll do a little bit more of the front matter while we wait for more people to settle in. So welcome to our webinar, Diverse Voices, Community-Based Approaches to Making Evaluation Attainable and Equitable. And now that I've given that territorial acknowledgement at the top, I would love it if some of you could use the chat function of Zoom to let us know what territory you're joining us from, if you know. I see some folks have already done that, so that's great. And if any of you are new to Zoom, I imagine you aren't, given the circumstances the past year and a bit. But if you just hover over the bottom of your screen, you will see a menu bar with a chat option. And if you click on that, you can open in the chat box and you can type it. And then I should also mention that behind the scenes today, we are joined by our communications coordinator, Yvonne, who is running slides for us today. So thank you, Yvonne, for doing that. And during this webinar, our age-friendly and community well-being specialist, Sarah, will also be in the chat with you. So if there's any sort of a conversation going on, she may be chiming in with links and resources for more information. Also, if you have any specific questions for our panelists, kind of on the left-hand side of the menu, I believe, there is an icon that says Q&A. And so that's where you should enter your questions. And then I'll be looking at them at the end and doing questions then. But I just think it's great to know that it's there. So if you have the question right in the moment and you think you might forget it, you can definitely pop it into that box right away so that you don't forget it. And if it's specifically directed to one of our panelists, make sure that you indicate that in the question so that I can field it to the right person. And then also outside of this webinar platform, if you'd like to follow along on social media, or if you'd like to tweet about what we're talking about today, you can use the hashtag #CommunityEval, and it's up there on the screen. We'll be live tweeting some of the highlights of this webinar as we go along, so you can use that later as a bit of an archive for some of the top learnings from this webinar. And I believe Sarah is putting the Twitter handles for both CESBC, our partner in this, and our Twitter handle at BCHC in the chat now so that you can follow along. And then just a reminder, today's session is being recorded and it'll be up on our YouTube channel, which is the BCHC, all one word, in just a few hours after we finish up here. So if you can think of anyone on your team or another colleague who's not here today who might like to see it, we'll be sending a follow-up email later today with a link so you can pass it on. Okay, next slide, Yvonne. So I'm just going to touch a bit on BCHC and our Plan H program. So for those of you who aren't familiar with BC Healthy Communities, we're a province-wide nonprofit that facilitates the ongoing development of healthy and equitable communities. And we believe that it's possible, but not just possible, it's necessary to create communities where it's easy to be healthy and well. And we also believe that by making those choices with community members' health and well-being in mind, we can move toward economic, environmental, and social sustainability. And that's why we do this work. And we're a team of planners, public health and evaluation specialists, community engagement practitioners, and researchers, operating at the intersection of planning and public health, which gives us a pretty unique vantage point. And I'm sure different people who are here are joining us with different sections of those lenses as well. So it's great to have you all here. BCHC does things like distribute grant funding, provide resources and program funded supports, and works directly with and for communities through partnerships and fee-for-service relationships. Next slide, Yvonne. And this webinar itself is part of Plan H, which is one of our programs, our largest program. And the Plan H program supports local and Indigenous government engagement and partnerships across sectors for creating healthier communities. The program, Plan H, is a partnership between BC Healthy Communities and the Ministry of Health in BC to support local governments and health authorities as they work together to improve health and well-being in their communities. We do this through funding and providing support for healthy community projects across BC, and also by developing and sharing tools and resources that help communities take action to improve their health and their well-being. And as I alluded to before, this webinar is also being done in partnership with the Canadian Evaluation Society BC chapter, who are providing some credits for their credentialing program for members who are attending this webinar. And special thanks to Sheila for her role in this. Sheila, the Vice President of the Canadian Evaluation Society BC chapter. We'll have more information about Sheila and CESBC later in the webinar. Okay, next slide, Yvonne. Beautiful. So today's three panelists will be speaking about equitable evaluation principles and sharing their experience and involvement with equitable evaluation from their various perspectives. That being the nonprofit perspective from BCHC, the evaluation professionals perspective from CESBC, and the local community perspective from a case study in the community of Oliver, BC. I have some bios for our folks here. Jody Muka is the Executive Director of BCHC and has a Master's in Environment and Management, along with over 20 years of community development experience working both at the local and international level. Sheila Matano is a researcher and evaluator with over a decade of experience in program evaluation, strategic planning, and stakeholder engagement, and is also currently, as I mentioned, the Vice President of the BC chapter of the Canadian Evaluation Society. Also, she is host of the Diverse Voices series, of which this webinar is a part, and we're excited to be in partnership with CESBC. And finally, Caitlin Bennett is a recent graduate of the University of Calgary, where she received her Bachelor of Arts in Communications and Political Science. And her background includes roles in food security and sustainable development, including recently the role of Food Action Coordinator with the town of Oliver, which she'll be speaking about today. Okay, next slide, Yvonne. So today we'll kick things off with a brief overview of equitable evaluation, and then we'll have panel presentations from our three speakers covering the questions of what equity means to them and their organization, how they incorporate it into their evaluation work, and what some of the challenges are that they've experienced and how they've overcome them. And after that, we'll move into some audience questions, and at the end, we'll share some links and resources with you. So with that, I'll hand things over to Jody.
Thanks, Johanna. So today we're here to talk about evaluation practices and approaches that are equitable and the role that evaluation plays in supporting or inhibiting the progress towards equity. And there's been a lot more discussion over these past several years around how to embed an equity lens into evaluation practices. And there's an organization known in the US known as the Equitable Evaluation Initiative. And they've developed a framework and some key principles that I'll introduce in the next few slides. And what's wonderful about this approach is that it's a really nice integration of cultural competency, equity, and evaluation. And so the one thing that we do know is that the primary approach to achieving equity is through addressing the social determinants of health. And by working upstream and creating conditions for individuals and communities to thrive, we're able to avoid many of those complex disparities that we're facing today. And so our work at BC Healthy Communities, our work is to provide programs, services, resources, and supports to communities all across BC to take an upstream approach to addressing those interconnected social determinants of health and thus decreasing health inequities. And so while equity is at the core of everything that we do, we're constantly exploring how to elevate our learning in this area and apply that to our work. So that's partly what we'll be talking about today. And so I think a high percentage of you on the webinar today are evaluators, and you will be familiar with the saying, what gets measured matters. And what we're talking about today really is how to embed an equity lens all throughout our programs, throughout the full life cycle, especially into our evaluation plans, so that we can better establish what matters for who and how to measure it. And so I'll set the stage for our panel presentations by first introducing two topics. What is equity? And secondly, I'll introduce the principles of equitable evaluation. So next slide, Yvonne. So what is equity? And for many of you, this might be something that you are already well aware of, but in order to have a conversation about evaluation that's equitable, first we need to talk about the idea of equity itself. And equity is the fair distribution of opportunities, resources, and power to meet the needs of all people, regardless of their age, ability, gender, or background. And all three of these elements are important when it comes to ensuring an equity lens is applied to the work we engage in with our communities. So it's really the element of power and the intentional actions we take to empower those who are marginalized or hard to reach in our communities that's key to enabling those opportunities to actually become available for those who are underserved. And we also want to ensure that resources are allocated in a way that does prioritize the voices of the marginalized in our work over the usual suspects that typically get picked and are involved in evaluation efforts in particular. And this is also about providing underrepresented populations with equitable opportunities to be heard. And then that helps to inform the decisions that we make and the way that we evaluate our process, our outcomes, and ultimately our overall impact. Next slide. So in this visual, you'll see equity means there's the difference between equity and equality. Equity means providing support and resources based on an individual or a community's level of need, instead of providing everyone with the same or equal level of support, resources, or opportunities. And when we're working with communities, equity over equality looks like asking questions such as, what are the beliefs, values, and assumptions that guide the topics that are being considered? Who's at the table? Who or what informs their thinking on the issue? Who might be most affected by these decisions and thus should be at the table? How can they be included? What might be the barriers to their participation? And creating structures and systems to ensure that you're engaging in an equitable manner all along the way that provides opportunities for the different levels of need for those that you're engaging with. So it's important that you begin your work by first applying an equity lens to your initial engagement strategies. And we led a webinar a few months ago on equitable public engagement, and that we'll send that link out with the materials after this webinar, but I think you would find that those resources helpful. All right, on to the next slide, please. So now on to evaluation that is equitable, or otherwise known as equitable evaluation. One of the most important considerations is the role evaluation plays in either supporting or inhibiting progress towards equity. And The Equitable Evaluation Initiative, the organization in the US that's developed this framing around equitable evaluation. And the way they frame it in particular is that it's an approach that addresses the dynamics and practices that have historically undervalued the voices, the knowledge, the expertise, the capacity, and the experiences of all evaluation participants and stakeholders, particularly people of color and other marginalized groups. And so we now have a framework to support our thinking around evaluation so we can actually work differently, which is awesome. And we can more easily incorporate cultural competencies, reciprocity, and equity into each step of our work. And it means aligning our practices with an equity approach. And even more powerfully, using evaluation as a tool for advancing equity. And what this does is it challenges evaluators to constantly question things like who, what, and why of evaluation, and question traditional evaluation approaches. So this framework consists of these three key components. Principle one, evaluation work is in service of and contributes to equity. And first and foremost, at its core, is the responsibility, or an AA responsibility, to advance progress towards equity. And principle two, evaluation work should be designed and implemented in a way that is commensurate with the values underlying equity work. And, this needs to be multiculturally valid and oriented towards participant ownership. This aligns with participatory action research, and it also has an element of asset-based community development as an approach. And finally, the third principle, evaluation work can and should answer critical questions about the effect of the strategy on the different populations you're working with, on the underlying systemic drivers of inequity, and the ways in which history and cultural context are tangled up in the structural conditions and the change initiative itself. And so this is really about what works for whom, under which circumstances, in what ways, and what results. So again, evaluators need to reflect and to question and adapt traditional evaluation methods in response to stakeholder engagement and input. And there's four key considerations to consider all at once. First, the diversity of our teams, and diversity beyond the ethnic and cultural considerations. Secondly, cultural appropriateness and validity of our methods. Thirdly, the ability of our designs to reveal structural and systems level drivers of inequity. And then lastly, the degree to which those affected by what's being evaluated have the power to shape and own how the evaluation happens. And this is really key. So this is definitely an important aspect of the tone that's being set for equitable evaluation. And Sheila definitely can speak more to this. I know she's very immersed in this topic area, and she's also provided us with some resources on equitable evaluation that will be shared with you as the materials get sent out post-webinar. So I'll hand it back over to Johanna now. Thanks so much.
Thanks, Jody. Okay, so next, we will be moving on to Sheila, who's going to present her panel presentation on the view of equitable evaluation from CESBC, the perspectives, the challenges, and how you've overcome those. Thanks, Sheila.
Hi, everyone. Next slide, please, Yvonne. Right, next slide. So before I start talking about, the work that we are doing at CESBC, I wanted to give a brief overview of who we are and what we do. I recognize that we have a newer audience that may not traditionally attend CSBC events. So what do we do at CSBC? We, like Joanna said, we are a chapter of the Canadian Evaluation Society, and we are a member-funded volunteer organization. We are a professional organization for evaluators and people who do evaluation work, or people who are interested in evaluation work as well. We have members from diverse backgrounds, different levels of expertise, and really our mission here is to provide, the community, the evaluation community, with learning opportunities, with networking opportunities, and provide resources, evaluation related resources that are easily to access. And we provide those on our website. We also have webinars and presentations. So we want to be a resource center, and we also want to provide opportunities for people to connect with each other around evaluation. Next slide, please. So when we talk about equity at CSBC, we don't necessarily have a program, but we are a member organization. And so while we are talking to the board and our members, when we think about equity, our main concern is sort of making sure that all voices are represented, that everyone has access and everyone has a seat at the table. We are working to ensure that our members have the opportunity to grow, to contribute, to develop regardless of their identity. We recognize that, we all don't start from the same place, and that there are barriers to doing evaluation work, to being an expert in the field. And we want to start by sort of talking about those barriers and finding out ways to eliminate them as a community, to have a space where people who might not have imagined themselves as evaluators or doing evaluation work can participate. Next slide, please. So while we were having discussions around equity at CSBC, when you look at the evaluation field in general, right, it's not as diverse as it could be. It's not as inclusive as it could be. And I'm not going to sit here and tell you that we've figured out the answer, because I don't know that there's one way to solve these problems, but we can start to have these conversations and we can start doing the work. So while we were talking about, equitable practices at CSBC and equity and inclusion and diversity on what does that look like, we started talking about how can we do the work. How can we make the board more diverse? How can we have new voices coming to the annual conference and presenting on their work? How can we work closer with communities and have them present their work so that we can all come from an understanding, from the same place, so that if evaluators understand how their communities work, then they can create and develop better evaluation systems, right? And in any other initiatives that we are engaged in, how can we make sure that all voices are represented, that everyone who wants to have a seat at the table has a seat at the table? And how do we do this in a real way? How do we actually do the work that we say that we're going to do? How do we do this work without causing harm? And how do we do this work in a way that's hopefully sustainable? The board is made up of about, I think, 10 members, and we're all volunteers. So when that board changes, we want to make sure that this work continues as well. Next slide, please. So what are the challenges, right? I think, as I've said before, it's sometimes really difficult when you look at the evaluation field, there are not many people that look like me, right? And even when I started working in evaluation, I was doing evaluation work, but I didn't consider myself an evaluator until a mentor said, no, you're an evaluator, you're doing evaluation work. And, I will support you to build your evaluation expertise, right? And I think there's a great space for mentorship. There's a great space for people who are already at the table, who are doing this work, to bring in, emerging evaluators, to bring in people who are maybe at the margins of doing evaluation work, to make them feel like they can participate and give voice to the work that we're doing, right? So when we were talking about the challenges, on our board and in our organization, we're thinking about how do we eliminate those barriers? How do we give space to these conversations? And what are the things that actually limit or impede diversity efforts? And how can we start to work towards limiting those barriers in the work that we do? Next slide, please. So, we just started doing the work in the best way that we could with the resources that we have, right? So I joined the board early last year in the before times, when we could actually see each other face to face and get hugs. So what I did when I first joined the board is we had a discussion around DI work, and we created a DI committee on the board, and I'm chair of that committee, and there are 4 other members. I don't know if they're here. We have Dr. Beth Snow, we have Damien Chen, we have a mentee on the board, Donna Primak, and we also have Connie, who I don't know if she's on leave right now, and she works at BC Healthy Communities. So we do have a great group with us, and we're slowly sort of doing this work and figuring out the best way to do it. So we started by developing a strategy for the DEI work, and we put in all our hopes and our dreams on that list, and we started thinking what are the things that we can accomplish in the year that we are going to be on the board, right? So we started implementing some of the strategies, and in 2020 we started with the Diverse Voices webinar. I think one of the reasons that we thought to bring this up was that at CESBC we tend to have sometimes the same voices speaking, and we wanted to expand that. We wanted to bring in communities to talk about the evaluation work they're doing. We wanted to see how communities are doing, this work, and what have they found to be the challenges, what have they succeeded at. And I think that information is pretty valuable to evaluators as well, right? Maybe we can replicate that work, we can share our knowledge, and we can use this knowledge sort of to advance this work in our communities, right? And we also created a mentee position on the board, which was, as I said before, I had never been on a board when I was in undergrad or grad school. And it wasn't until somebody who sat on a board in a nonprofit invited me to join and explained to me how boards run and how that work was done. And I thought it would be a great opportunity to offer that to somebody else as well. And that's why we created this position on the board. And we hope that it will continue so that, somebody who hopefully is in the mentee position will hopefully become a board member and understand how the board runs. And in that way, we build capacity and we build space for people who might have not joined before, right? And so this year, it's been quite a difficult year. It's been hitting that pandemic wall, and we've restarted this Diverse Voices webinar series, and we hope to continue it. And so I just want to invite whoever is on this webinar today, if you have a story to tell and you are doing equitable work, or you're doing equitable evaluation, or you're connecting with communities, and you want to share your story with us, please reach out to us. We can have you present at a webinar like this. In the future, we hope to have many more conversations so that we can learn from each other. Recently, we just released our CESBC DI statement, and I'm grateful for the board for sort of walking through this process with me. It was a difficult process of sort of deciding what we want to say and what do we want to do, and it was supportive, and we were able to sort of craft the statement. And I want to invite you to read it. It's on our website, and if you have questions or if there are any other initiatives that you think we should be engaging in, please reach out to us. I'm on Twitter, my email will be available, and I'm very open to having these conversations with you. So reach out. We also just recently started the DEI Bursary Fund to support members from underrepresented communities to access evaluation training, to access evaluation conferences. So, it's at one time, I think, annual disbursement of $250, and we've had a few applications come in. I know the CS conference is coming up, so if you're on this webinar or and you want to apply, please apply. If you know somebody who may be interested, send them to us. We're looking to give this money away, and we hope that we can continue with this fund, right? For the future, what we're looking to do is just provide more professional development opportunities at free or low cost, and continue to do this work and to evaluate it. Next slide, please. Like I said, I think we at the board and in our organization are really working to create a culture that strives for equity, that embraces, respects, and accepts and values difference. I think this is ongoing work. It's not easy. We do not have the antidote. We do not have all of the answers, but we are open to having this conversation and continuing this conversation. And we invite you to join us and to continue this conversation with us. If you think that there's something that we should be doing that we are not doing, we are happy to have that conversation. If there's something that you have to offer, right, we're happy to, bring you into our organization and offer, your expertise to other members as well. So, we're going to be here, we're going to be continuing, and I hope that you can join us. Thank you.
Thank you, Sheila. Thank you for all those great resources. I do, before we continue on to our next panelist, just want to remind folks, I see a few questions in the chat about resources that are being shared. Yes, we have a document compiled with all those resources, so they will definitely be emailed to you, so you don't have to worry about that. The second thing is that I see quite a few questions that are being put in the chat rather than the Q&A. So if you hover on the bottom of your Zoom screen, there is a Q&A tab, I guess it is, or a button more towards the right. You can click on that, and that is where you can put your questions. And please just let us know if your question is for a specific panelist, if you can indicate that in your question in the Q&A. Thanks so much, folks. Okay, without further ado, I'll bring forward our next panelist, Caitlin Bennett. Caitlin is going to tell us about her experience with equitable evaluation in the community of Oliver. Take it away, Caitlin.
Awesome. Hi, everybody. My name is Caitlin Bennett. I'm currently in Oliver on the traditional and unceded territory of the Syilx people of the Okanagan Nation. So next slide, please. So I was in the role of food action coordinator for the town of Oliver, and this was implementing their 10-year long-term food action plan, which essentially was a plan made up of 5 major goals and 6 minor objectives to improve our community's food security. So this is access to healthy, affordable, ethically sourced food, regardless of your means or your occupation, your wealth, anything like that. Just making sure that people in our community have access to food. So 2 of the projects that we ran that are mostly what I'm going to be talking about is the Harvest Hut and the Edible Pathways. So we did receive funding from Plan H for the Edible Pathways, and that's kind of how I got drawn into this sort of relationship and working with them, and that's kind of how I started learning about project evaluation. Next slide, please. So the Harvest Hut is a free produce exchange. Essentially, people bring extra food from their farms or gardens, and then we just give it out to anybody for free. So it doesn't cost anything for people to participate, and we don't limit how much you can take or who can take it. So right now, this program serves families, seniors, members of the OCS Indian Band, and members of our unhoused population. So the Edible Pathways was sort of meant to be a separate thing that really merged into being one unit. Essentially, what we did was we replaced the plants on Main Street planters with edible food. So tomatoes, basil, oregano. The first iteration was really like a spaghetti garden. So everything you needed to make a spaghetti sauce. We found that as part of our Plan H grant and sort of part of the parameters of that was needing to evaluate and trying to come up with a model for seeing how many people were using this and was it really improving people's food security and their ability to, learn how to grow small gardens in small spaces. Next slide, please. So really as part of that evaluation, we needed to kind of realize that there was 2 reasons to do this. One reason that we were looking at this project was for stakeholders. It was for the people that were providing funding. It was for the municipality. So Do they have reason to keep funding my position? Do they have reason to keep providing resources and using staff hours on these planters? But the other reason was more for participants. So are the people in our community that are food insecure, that don't know how to garden, that are needing additional resources, is this really benefiting them? Are they getting access to it? Is this service easy for them to use? So these two types of really evaluation that we were doing started looking different. For stakeholders, it was really quantitative. It was getting numbers, it was getting data and budgets. And for participants, it was really qualitative, like just asking them and getting that feedback back. And this was really something that we needed to do to see if we could keep running the project the way that we had originally developed it. Next slide, please. So when we were talking about using equitable engagement for the municipality, the food action plan was developed by third-party consultants, and it was developed with outside funding. And then there was a formation of a subcommittee. So this committee was made up of people from businesses, from local government, from the Parks and Recreation Society. And so from looking at it through an equitable lens, these might not have been the people that would also be using this service. They might not be food insecure people. These people might be in a more stable position. But when we were looking at our engagement with participants, you know, the Harvest Hut didn't have the same barriers. It wasn't limited to just a small group of the participation. It really was non-restricted based on your wealth, your employment status, where you worked. It was really just meant to be there for the community. And if we could share it with people, we would share it with them. So it was sort of different in the way that we were really trying to bring this project to anybody. And it came from a plan that wasn't necessarily developed with all those types of people on the board or right in the committee, right in the decision-making process. So then one thing we did to try and see, like, were we really representing the needs of people, was start asking them questions that maybe had been asked earlier on. So for users of the service, we really wanted to ask them about their experience, ask them if they lived inside or outside of the municipality. How did you get here? How did you hear about this? And what other resources are you looking for? The next slide, please. So we had a few challenges implementing the plan, as well as getting sort of the edible pathways and harvest initiatives off the ground. One of the main ones was it was really hard to keep business owners engaged and sort of third parties that didn't really feel connected to the mission. It was hard to keep them engaged because we didn't necessarily see the planters bringing people into the businesses to ask questions, to get the resources. And originally, you know, we thought we really would see that. It was also, on the other hand, it was hard to connect with lower income and unhoused or less mobile community members. So the people we thought, wow, they'll be so excited, they'll use this project. When it really came down to it, we weren't seeing that in the first year. And we also found it was even hard to evaluate this without being able to talk to them. We couldn't monitor Main Street 24 hours a day. We couldn't be at each planter all the time and see who was using it. So we found that like there was this really big gap. We didn't know, was the edible pathways really serving business owners or food insecure populations in any like real way? So we had to kind of come up with a new way to do this evaluation. We needed a new way to get these answers. Next slide, please. So the way we were able to start getting these answers was actually by bringing it to the Harvest Hut and by making that part of how you access that service. So when you came and you wanted to get your free zucchini and your free tomatoes, we just say, hey, like, did you know there's vegetables in our planters? Hey, have you been getting oregano, or did you get cucumbers when you were visiting Main Street? We started asking people like, hey, how did you hear about the Harvest Hut? Like, did you hear about it from the food action plan? And the majority of people, that's absolutely not how they heard of it. They had no idea what that was. So then that kind of helped inform us what we should stock as far as materials. Okay, let's bring in pamphlets that state, what the project is and how you can get more information. Then people start asking us, great, like they have that information. Well, how do I access kitchens, or how do I access the food bank? Okay, let's start bringing in those materials. And so it really became a way of saying like, hey, evaluating this project up on Main Street and trying to ask people, trying to stand on Main Street, trying to ask business owners, that's not going to work. But what we can do is we can count how many food bank pamphlets we had. We can count how many resources we had to counselors in our community, and we could see like how many of these are going out the door. We could start recording questions people were asking us and saying, okay, how many times are we getting this question? Maybe we need to start bringing in that type of food or that type of pamphlet, or we need those phone numbers here. And so we were really able to adapt by just like having conversation and really scaling it back from sort of that more clinical that approach we had at the beginning, where we were trying to match like our logic model and really measure specific inputs and activities, and that wasn't going to be practical for us, at least not in that first year. The next slide, please. Yeah, I think so really, yeah, that was sort of our experience, was just adapting as we went, and we were doing that adaptation based on just conversation, just feedback we were getting, and what was going to be practical. It wasn't going to be practical for us to measure maybe every single person that used the edible pathways and walked on Main Street, but it was going to be really practical for us to count every number of people that used the harvest hut. Last year we served over 3,000 servings of vegetables, and we had thousands of pounds worth of vegetables go out, and 99% of people that used that service last year were from our community. So it was just shifting kind of where we were doing that look. It didn't mean we weren't looking at that project anymore. It didn't mean we were ignoring that project anymore. It just meant that we needed more time to ask those questions. We needed just kind of more opportunity to interact with the people, and the harvest hut ended up being a great hub for that. It was really a place where we could have conversations, and we could just take more time to see if what we were doing was being sort of more effectively used by people. Yeah, and that's sort of everything I have to say about the harvest hut and the edible pathways.
Thanks so much, Caitlin. That was great. And as Helen is saying in the chat, it's so great to see this adaptive approach to evaluation with an emphasis on how to best serve the community. I couldn't agree more, Helen. And so lastly, we will go back to Jody to present from BCHC's perspective, the challenges, the ways of overcoming them, how we see equity in our organization, and how we implement equitable evaluation. Over to you,
Thanks.
Jody.
Yeah, and thanks Sheila and Caitlin. That was great. Next slide, please. Yeah, so overall, what does equity mean to BC healthy communities? I mean, equity is at the heart of healthy communities work, and it's at the heart of everything that we do. And you can't really create a healthy community without using an equity lens. And so first and foremost, our approach is based on the World Health Organization's Healthy Communities approach that's built around 5 key building blocks. But within those, there's really an explicit intention to be ensuring that equity is embedded within all the practices of the work that's done at the community level. And then next, I was talking earlier about the social determinants of health. So 75% of, back to that previous slide, thanks. 75% of our health outcomes in life are actually determined by the external factors. And those are the determinants of health. And that really is where our work takes place. And those are the things, the considerations like food and access to food and living conditions and housing, social norms, attitudes, discrimination, racism, social connection or social isolation. And so again, our work is connecting the dots with multi-sectoral groups across those various determinants. And we make the links between these elements in terms of the supports or the inhibitors to our health status. We do this through working at an upstream approach and by asking the right questions all along the way. And next, our work also spans across planning and public health. And within the field of public health, community planning is seen as a tool to address the determinants of health. And community planning, from the planning standpoint, local government and the policies that are developed are the things that actually can influence equity and ensuring that it's also a component of sustainability overall. And if you go to the next slide, in terms of what it looks like for our work, I look at it from two different perspectives. There's the work that we need to do internally as an organization, and that includes our values. One of our 5 values is equity. And for our strategic focus, we always are also focusing on equity and what that means as we plan our operations, as we plan our programs, and throughout the policies and systems that we develop internally. And then in terms of externally, that's really about the services and our offerings. Those are the programs that we deliver and the services that we offer. As simple as ensuring that our grant program, that the application process is accessible, that everyone has equal opportunity or opportunity to apply for that grant program, and it's made easy. We work with community members when they're interested in filling out applications and applying for our grants. So we provide them with supports that they need along the way. They have different needs. We work with them to support them to make their applications. And in terms of the work that we do in communities, it starts with doing an assessment, working with them, understanding what their needs really are, and then tailoring our customized supports to meet their needs where they're at and ensuring that they're applying an equity lens to the work that they're doing. And unique to our work, so we in our work would be supporting someone like Caitlin, who is actually on the ground in her community doing that work. And we're there to work shoulder to shoulder with her to provide her with the supports to assess where may there be gaps in terms of applying an equity lens to the different processes and the evaluation mechanisms in the community. So all to say, we are constantly looking at where there may be some gaps in what we're doing and what is there that we can newly learn. And of course, there's challenges. If you can go to the next slide. Some of the challenges in terms of being an organization that receives funding, we receive funding from the funder, but then we're also a funder. So we're distributing grants out to communities, and we have some limitations and challenges in terms of what the parameters and what we're able to do with some of those funds, the timelines, and the flexibility for us to co-create and design with communities. And then there's also researchers and funders have to give up a certain amount of power and control, and that causes uncertainty and discomfort when you're working with this different approach and you're working more directly with communities. And timing is definitely a challenge in terms of building relationships and making the processes equitable and allowing for full participation. Sometimes it's very challenging because of the funder timelines, and we know that it takes time to develop relationships with different populations and gain that trust. So there's definitely some constraints around that. And then of course, there's some challenges in terms of resources and capacity and the time that it takes, the ability to share materials, review materials, and take more of that community ownership perspective. So on to the next slide. In terms of solutions, well, first and foremost, I think taking an approach that is equitable, an equitable evaluation approach, allows you to have a lot more depth to your evaluation. And it brings in the opportunity for the projects to be evaluated, not by the evaluators or the experts, but by more participatory approaches with community members themselves, who really are more of the experts in terms of what's going on in that local community. It gives you more opportunity to consider the intersectionality of what, you know, the participants within your communities. It's more culturally responsive. And you don't necessarily have to have the same level of academic rigor. Really, it's more important that it's based on respecting the needs, the wants, and the values of the communities that you're working with. And you are able to draw on the principles of asset-based community development. It's community focused, focused on inclusion and diversity. And if you can build equity into all aspects of the process, you're building it into your evaluation plan right from the beginning. And that then is also informing the design of the programs, the deliverables, your activities that you're rolling out. And, you know, I guess it also, if you think of KISS, like keep it simple, it really does give you the opportunity to measure what matters and hear about what matters from the people that you're working with directly in the communities. So equitable evaluation allows for equitable opportunities for those to tell their stories. And that's really what we're striving for in terms of healthy communities for all, is that everyone has a voice. So I'll hand it back to you, Johanna, for questions, and take it away.
Okay, great. It looks like we have about 6 minutes left, and we have 3 questions, which feels like a completely possible feat. So the first one we have here is from Crystal. She asks, in our evaluation efforts at UBC, we are using an equity lens and decolonizing approach. I'm curious how the evaluation framework and work being presented is advancing decolonization specifically. And that wasn't addressed to any of our panelists specifically, but does anybody want to field that one?
I can jump in and take that question. I think when you're talking about equitable valuation and decolonization, I'm not sure that there's a framework that can solve all your problems. The essence of equitable evaluation is that you are looking within your context and you're looking at the communities in which you are working with and figuring out what is the best way to conduct this evaluation, right? And I think it speaks to a lot of the things that Jody had said, right? Every context is different. And I think for me, right from the beginning, when you're trying to do an evaluation, the question is who is this in service of? What is this for, right? And, you know, when you're doing an equitable evaluation, you're always trying to do work that's in service of the community, right? And so the question is, you know, for your evaluation, how can you closely work with the community that you're with to develop your evaluation plan, right? And when you're collecting information from your community, you know, what are you considering as evidence? You know, there's a lot of conversation going on right now about the hierarchy of evidence and how it doesn't sort of prioritize community voice or community stories. It's always at the top, looking at research and very strict research protocols. But how do you then become flexible in the way that you do your work to accommodate community voice, right? And there's also this issue of sort of like funding and timelines, right? Sometimes the community doesn't move as fast as, you know, as researchers do or as evaluators do. Can you give space for the community to understand what you're trying to do, right? To, you know, to understand what you're trying to do and go along with you, right? And when you've collected your information and you're analyzing it, you know, when you're looking at it closely, how are you making sense of the information that you've collected from this community, right? Are you doing it in a silo? Or are you presenting it back to the community and making sense of it and coming to conclusions together, right? And once you collect this information and you've developed your awesome report, is it been shared back to the community, right? Who gets to see it, or does it get to sit in, you know, a nice office or in somebody's drive and is never seen, right? And, you know, I think also the question is, what kinds of decisions are being made from this evaluation, right? Is this, is this report going to determine if a community gets funding in the future? Is it going to determine how this community is seen? Like, what are the power dynamics and what's happening exactly with this evaluation? I think, trying to look at whatever evaluation work you're doing from the lens of we are doing this work in service of the community, I think is really important. And once you have that in place, it's not necessarily easy, but it's a good place to start, to make sure that everything is inclusive, right? I think there are many, many more conversations to be had around equitable evaluation, and even our practice as evaluators. People always viewing the evaluator as the expert, and that's not necessarily true. The community is the expert. Talking to funders sometimes are very restrictive in what they want to see in an evaluation. I think there are many more conversations that need to happen. But in your practice, when you're doing this work, always ask yourself, who is this in service of? And how can I bring my community along? I'm not sure if that answered your question, but I'm happy to clarify if I need to.
Thank you, Sheila. I do see that it's 12:58. We have a few more questions that have popped up as we're discussing this, but I also want to honor people's time. So maybe we can just tab forward to the next slide and I'll just explain the resources, and then we can go back to questions after. So yeah, we at BCHC hate to leave you without some actions that you can take right after this webinar. We hope we got you a little fired up and now you can do something. So we have a few actions here. We're going to be sending out, as we mentioned before, a curated list of resources, supplemental learnings, and tools for applying what you've learned in this past hour about equitable evaluation. And we'll provide you with a link to a recording of this webinar, and we encourage you to share it with your colleagues. And for those who consented to having their contact information shared with fellow webinar attendees, you will also receive a contact list to support you in collaborating with and learning from others across organizations and sectors. And we will put the email addresses of the folks who joined us today as panelists in that email as well, so that you have those. So now we can go back to questions. So the next question we have is from Effie, and this is specifically for Sheila. Sheila, you're in the hot seat. How did the board at CESBC recruit for a mentee position? I'm on a board that is working on having diverse voices while also meeting organizational priorities. Next year, I'd like to have a mentoring component for new board members, but I really like this idea of a mentee position. So yeah, can you say a bit more about that?
Sure. It was actually pretty easy. I went to the board and I said, hey, I want a mentee on the board. And they were like, yeah, that sounds awesome. Do it. So we created a profile of what we needed. We shared, I think we have a huge mailing list of over 1,000 members. So we shared the mailing list, we posted it on Twitter, and, those who knew someone also talked about it with their networks. And, I'm happy to share what was in that document. And we got some applicants and we interviewed and we got our mentee. So, yeah, it was pretty easy. And Dana is on this call and she is our mentee on the board. And it's a really great initiative. We've been able to do a lot of work with the support of our mentees. She's been able to do a lot of research and, support a lot of our work and, add to the DI resource document. So if you're on this call and you're interested in that document, please let me know or send me an email and I can share that document with you so you can tweak it for your purposes and get a mentee on your board. And I encourage everyone who's on your board to have a mentee. I think it brings that diverse voice, it provides opportunity, and this is how we improve the system, right? So thanks.
Great, thank you. Just a couple more questions. Oh, we have more questions. Oh my goodness. Do you have an example, an evaluation tool that uses the equitable approach?
I don't have one. I think in the past have just used the equitable evaluation principles in my work. I haven't necessarily found a tool that works specifically for the communities that I work in. I work with a lot of nonprofits when I do consulting work, especially communities of color that are very under-resourced. So I tend to build evaluation tools and evaluation frameworks that are specific for that. And I think this is where I would say, if you have an opportunity to read the evaluation framework and do a little bit of reflection on the work that you do and see how you can incorporate some of those principles in your work. I'm hesitant to say that there's this perfect tool out there that can help you do this work, but the truth is there isn't, right? No communities are the same. No communities will sort of be working towards the same goals for every evaluation. So I think whatever context you're in, whatever community that you're working in whatever space, you can incorporate those principles and start to figure that out in partnership with the communities that you're working with, you know, just by asking them what will work for them and going from there.
Yeah, and the other thing that I'll add is, you know, if you have a good set of questions that help to guide you to ensure that there's an equity lens embedded within what you do, you can use those questions alongside participatory action research, you know, some of your other evaluation methodologies as a bit of a start. So it's the interplay of some of those things, but we will be sending out there's some really good resources, and some of the resources that Sheila gave us to send out to you will be helpful in that regard.
Great. So we do have a couple more questions, but I think just to balance people's time, we will respond to you directly. Nuha, Amalia, Nahum, I've noted all your questions, and we can get back to you about those directly. And I see a few of them are to specific people. So Yvonne, if we can just move on to the last slide. When we close up here, a survey will pop up in your browser. We really appreciate it if you would just take, it says 4 minutes is the amount of time it will take. So hopefully you can take 4 minutes and just let us know what you thought. We have the email addresses of our panelists here. And if you want to contact them, we will also be sending out these slides. So you will still have access. You don't have to write them down right now. And thank you so much, Jody, Sheila, and Caitlin for this discussion today. A special thank you to all of our attendees who participated in the webinar. The chat was, you know, very active, and that's always nice to see. Nice to see that people are engaged. And thank you to all of our staff team who made this webinar happen today. So a follow-up email with information and resources will be coming your way either later today or early tomorrow, Saturday morning. And we look forward to staying in contact with you. Thank you so much and have a great rest of your day.